Endometriosis is a common condition observed in women of reproductive age. It touches more than one woman over 10. It is a disease in which tissue that normally grows inside the womb grows outside it. It grows in several locations, such as ovaries, bowel wall, vagina wall, even lungs sometimes. During periods, these tissues are bleeding and it causes inflammation. There is a wide variety of symptoms due to various locations. Main symptoms are strong stomach pain, back pain, chronic fatigue, pain during intercourse, severe blood, and heavy bleeding. This case report is about a 36-year-old Korean woman who presented to the emergency room for stomach pain and vaginal bleeding. Her last period were 5 weeks ago. She already had one pregnancy, which went well. Clinical examination was normal, besides a small vaginal bleeding. She had no fever, no trouble breathing. Her heart rate was normal as well as her blood pressure. In order to understand the origin of her pain, the medical teams did blood and urine sampling, which showed a small diminution of her red blood cells and a high level of HCG in her urine and blood, which meant that she was pregnant. Then they did an ultrasound of the lower part of her belly, called pelvis. It revealed a large amount of liquid in her stomach. Due to this fluid, ovaries were not well visualized. Despite the positive pregnancy test, there was no fetus in her womb. At this point, doctors had two hypotheses. The pregnancy were outside of the womb. It is called an ectopic pregnancy. Ruptured ectopic pregnancy can cause a bleeding in the belly, or the bleeding may come from ovaries. During the hospitalization, the patient started to feel bad. She developed pallor and dizziness. At clinical examination, her tummy was hard, over-distended, and very painful. Her heart rate increased to 101, and her blood pressure collapsed. Seeing the urgency, the medical team decided to operate the patient in order to stop the internal bleeding. They entered in the stomach with a very small camera. Surgeon removed 1,800 milliliters of blood. Then they searched for the origin of the bleeding. The blood was coming from the abdomen wall. Surgeons stopped the bleeding and collected a sample of tissue for analysis. They inspected ovaries and the womb, and everything appeared normal. After surgery, the patient condition stabilized. Analysis of tissues showed that the belly wall was invaded by endometriotic lesion, which was causing the bleeding. A new pregnancy test was realized and it was negative, which confirmed spontaneous abortion. Final diagnosis was internal bleeding due to endometriosis. This is the first case report which shows a massive internal bleeding and spontaneous abortion due to endometriotic lesion. It is probably a very rare situation, but gynecologists must be aware that it can happen.